Life is a journey, and at one time we get towards the end. When the time comes and all that could be done have been done, at curative care, treating the cancer, taking care of the heart disease, the kidney failure, the time comes when we need to make peace. Patients like this come to hospice, and when they can't be cared for at home, we often care for them at hospice house. The mission of hospice is to ensure that patients retain their dignity and to ensure that the patient and their caregiver have all the support, medically, social, culturally, or otherwise, that they need. The caregiver and family members are integral parts of the whole hospice process. They can be here all the time, 24 hours a day. We do not have visiting hours, and this is very important to families and to loved ones and friends who haven't seen these patients, who come to show their support and to sometimes say goodbye. And it's actually very important to the family, to the patients, and we encourage that. We have a beautiful garden around the building that provides a home environment. That's why we call it hospice house. We have kitchen where people bring in their food, cook, and gather around the dining table and eat and celebrate the life of their loved ones. We don't see this as an end, but actually a new beginning. We have the living area where family often spend time, sit around, and like I said, also meet with other people who may be going through this. And the other advantage is that you have 24 hours care from the professional. The nurses are on 24 hours. They make frequent rounds on patients. Pain management is a very important part of hospice. At home, you can give them medicines by mouth, the patch, and other type of treatment, but sometimes these don't work anymore. And we, at the hospice house, we're able to go further. We do IV medications. Sometimes we even have to put them on a drip to ensure that there's consistent pain control. We just want to make sure these patients are comfortable and we treat their pain as aggressive as possible. That's why some people actually call hospice the other critical care center. The majority of Americans actually want to die at home. I mean, home could be different places, but they want to die at home. Most hospice care actually happens at home. So a lot of family, they do a wonderful job caring for their family members at home, but sometimes they suffer what we call caregiver burnout. Imagine being there 24 hours a day, having to attend to the every need of your loved ones. You love them, you want to do it, but you have the pressing need. You have a grandson graduating from college. You have you need a break, just 2 days to go away and visit your other members of the family. In such case, we have what we call respite care. The families can come into inpatient hospice for typically 5 days, sometimes longer or sooner, a few days if they so wish. And we take care of these patients in the inpatient setting, continuing the same food they were eating at home as much as possible, continuing their medications, managing their pain, being seen by the physician every day, as well as the nursing staff, as any other inpatient hospice. And when the family members are ready to resume care of the loved ones, they are rejuvenated. They, ready to start afresh. It's a difficult road, but together we found out that we can do it best. It takes a special type of person to do hospice care. And as the medical director, I have seen it. The nurses go above and beyond. they don't take themselves into consideration, but the comfort of the patient. They make hourly rounds and often more frequently. When they administer medication, they come back very quickly to see how effective this is. And we have the chaplain who is specially trained for this, to take care of people's spiritual need during the dying process. And the social workers are specially trained for the financial, the social, and other support that not only the families, but not only the patients, but the caregivers may need. It's just a wonderful staff. We have the NAs, and the managers. Everyone is tireless when it comes to making sure that person is comfortable, because we know this is a stage that any of us could finally get to, and to make sure patients are comfortable and their dignity is preserved is what the staff here is for.